certainly the biggest work product of the summer of 2013 here at the State House is whether we're going to expand Medicaid to cover low-income, primarily cover low-income adults. And the Medicaid Commission has been meeting pretty much weekly to deal with this issue. We've had 3 meetings already, a lot of shadow boxing, a lot of important information, but we're not really even into the argumentatory stage right now. It's still the fact-finding stage, and that fact-finding becomes significant this week when a national panel of experts will talk to the Commission. This panel is important for the following reasons. Even the proposal that Governor Maggie Hassan supports and that the democratically controlled House of Representatives adopted requires some support from the Obama administration, whether it's a change to the Medicaid plan or an actual waiver from the requirements under expansion of Medicaid. So it's important to hear from national experts about what are the likelihood of Governor Hassan's plan getting support from the Obama administration. What about a hybrid, something such as the state of Arkansas has been exploring and actually adopted a support for such a plan in the state budget that would really involve more of the private insurance market, would allow people who are eligible for Medicaid to retain or obtain private health insurance and have the Medicaid benefit follow them and support the premiums they would have to pay under that private insurance. We heard the insurance department last week essentially say that it's going to be very difficult to put that kind of program together and have expansion of Medicaid begin in January 2014 as the federal law requires. That's something they suggested probably could be instituted in future years, but it'll be really difficult to get it up and running in the next few months. The problem is more involvement of the private insurance market in the expansion of Medicaid is clearly one of the ways to get Senate Republican votes that Hassan needs to get an expansion of Medicaid bill through the legislature. Right now, the 13 Republicans actually ended the session in the state Senate very united against Hassan's plan. I think with some tweaks, it's very possible that Governor Hassan could win the support of Hampton Republican Nancy Stiles, who's serving on this commission. She has had complimentary comments throughout the year about the notion of expanding Medicaid. But where do you get that other vote? You've got the 11 Democrats behind the governor. Perhaps you have Senator Stiles. It's at 12-12. No bill passes the Senate without that kind of support. So the governor and her supporters in the House really need to figure out a way to tweak this expansion to essentially gain at least that last vote they need. This national experts panel we're hearing this week may help provide them with the roadmap for them to do it. We'll see, and we'll follow it for you here at nationaltelegraph.com.